Hello, everyone. We welcome you as you file in. Want to let you know you are in the right place. This is the Safety and Health Magazine webcast sponsored by the Board of Certified Safety Professionals. Just going to allow another minute or so for everyone to file in and get settled. But we thank you for joining us. Hello and welcome once again, everyone. Just allowing a little more time for folks to get filed in. We'll get the presentation going in about 30 seconds from now. Thank you. Okay, an official hello, everyone, and welcome to today's Safety and Health Magazine webcast, The Importance of Growing the Safety and Health Profession, sponsored by the Board of Certified Safety Professionals. My name is Kevin Drewley. I'm an associate editor with Safety and Health Magazine, and I'll be moderating today's session. Thanks for joining us. We hope you all are doing well. In a few minutes, we'll start our presentation, but first let's review some preliminary items. The views of today's speakers and organizations are their own and may not necessarily reflect those of the National Safety Council or Safety and Health Magazine. Any mention of a commercial enterprise, product, or publication does not necessarily mean the council or magazine endorses those items. At the end of today's webcast, we'll conduct a question and answer session. To ask a question, simply click the Q&A button at the bottom of your screen, type your question, and click the send button. Feel free to ask your question at any time during the presentation. You don't have to wait for the question and answer session to begin. We'll try to answer as many questions as possible today, but because of the large number of participants, we might not get to every question. Any unanswered questions will be forwarded along to today's speaker. At the end of the webcast, you'll be asked to complete a brief evaluation survey, and we'll let you know more about that after the presentation. Today's webcast will be archived, so you can access it after the live event. To view this webcast and all of our past webcasts, please visit safetyandhealthmagazine.com/events. With that, let's go ahead and get started. Our speaker today is Carl Heinlein. Carl serves as a senior safety consultant for American Contractors Insurance Group, an organization he joined in February 2002. He contributes to the successful safety initiatives of multiple construction clients and also volunteers time as a member of the NIOSH and NORA Construction Center. A past president of BCSP, Carl earned a master's degree in safety and environmental management from West Virginia University. Again, we thank you all for tuning into this presentation. Carl, whenever you're ready, go ahead and take it away.
Well, thank you very much, Kevin. Appreciate it. Hey, thanks for everybody could join us today. The topic of our conversation, the importance of growing the safety and health profession it's extremely important to me, seeing that I've been in the profession almost 33 years. But I've just watched what it's done to organizations, communities, not only domestically around the world. So there's a great passion on what we're going to talk about. So, couple things. I want to certainly thank the National Safety Council and Safety and Health Magazine for all they do to get the message out. And certainly want to thank the Board of Certified Safety Professionals. It's an interesting journey how I really ended up in safety. My undergrad's in business. I'm a marketing major, business administration. And I just happened to talk to a friend of mine back in we'll just say early 90s, about this safety program I'd heard about at West Virginia. And really, the first time I met with some of the professors and some of the students, really kind of, I thought that I would be able to utilize my business skills with some of the risk management skills. And 33 years later, I would never change what I've done. It's been a wonderful career. And so what we're going to talk about today, and I hope that everybody on the call, we do a lot of webinars, we go to conferences, we talk with a lot of folks at the local and national and regional level. I just want to throw out a couple of things before we start, and then I'll get into the content. I want to ask you to do three things today, and one is I want you to be honest with yourself, and really honesty is how we grow, how we learn from the past, move forward, and not only for ourselves, but maybe our teams. Maybe we have some folks on here that are leaders that have teams that work for you, and you want to kind of help them grow into the profession or pull people into the profession. The other one is participate. And I don't need your hand up or anything, but if you have questions, please ask me. And then for some reason, I mean, we only have an hour slotted. I'm always available to ask questions, talk about certifications, associations, societies. It truly is a passion of what I've done. And now that I'm past that, towards the end of my career, I want to make sure that I continue to give back. And last thing is let's have a little bit of fun. Sometimes we do some presentations and they're kind of stiff and boring, and I don't want to be bored, and hopefully you don't want as well. So, next slide, please. So my good assistant Isadora, and if you noted on the front of the slide there, the organization I work for, our mission is when we're an insurance company, we're a captive insurance company. It's saving lives and preventing injuries. That is our mission statement. And that is from our CEO to our board of executives to all my teammates, and then our 40 contractors I work with. So I've been able to be around a lot of people that are leaders in this industry. They have passion for it. But I think one thing that you see across the board, if you kind of make a little note beside it, we're in the people business. Regardless of all the technology that's coming up, and we'll talk about that during the presentation, all the robotics, the AI, the technology, things of that nature, we are still in the people business, and it's a very valuable place to be. There's a lot of onus on us to work hard and try to help our folks learn and coach them up, and not only on the job but off the job. So we'll talk about that as well. So what we're going to talk about today is we're going to do a couple polls to see what everybody on the call thinks. Um, and then again, another suggestion, maybe we write this in the box here, or you kind of take it down, is I really hope that you have a personal action plan. What you want to do this year? What do you want to do next year? What do you want to do in your career? And I was fortunate enough to work for some wonderful people that were my mentors. And trust me, over my career, I've gone sideways or slowed down or went too fast. And they were there always to kind of coach me up. And I mean, they're wonderful, important people in my profession. And I hope that you have mentors in your career that help guide you and coach you and maybe scoot you a little forward on some initiatives that you want to do. And then also for folks on the call, you may be those mentors as well. So when you're taking a look at your teams and folks that you're working with, think about how you can kind of keep them moving forward. I've worked for bosses in the past that said, if you're not changing every 2 years, you're missing opportunity. And change doesn't mean jobs. It may be getting another certification, another degree, stretching beyond safety, maybe into risk management or claims. So we'll talk a little bit about yesterday. We'll talk about the present, and then we'll certainly talk about tomorrow. So next slide, please. So before I get into this, let's throw up the first poll if you don't mind. All right. So our first poll is, how prepared is your company for developing the future safety and health professionals? Good. Seeing the answers come in. Okay. All right. And I think what we'll do is we'll come back to these as we get into the meat of the presentation. So I guess we'll leave that up for about another 30 seconds. And as we're doing this poll, I want you to think about this as well. As even though we are individuals in a profession, it takes organizations and partners to collaborate and help grow the profession as well. So when I work with a lot of young students or students of any age around the country, one of the things that we do have a conversation. So somewhat prepared, not prepared, very prepared. Well, that's good. That's a good mix. Again, and that's one of the things I always like to see in my presentations is that honesty. And that's what we're going to have some discussions about right now. But I think as we grow our profession, we also have to think about the organizations we work with. And there are some spectacular organizations that take time and effort to grow their professionals. And there's other organizations that's just not part of what they do. So as we go through our careers and we're helping mentor folks or just ourselves, think about the organizations you want to work for. So here's I just pulled this off the internet when I was developing this presentation the other day. So we have five headlines that came out. Why the occupational safety and health is a good career. The future, how safety will continue to evolve. The current state of occupational safety and health, our perspective, why we need more safety and health professionals, big growth and change expected for the safety profession. So when you take a look at those, if you're a young professional or an individual that's maybe stagnant in their job and wants to move over, these headlines alone should at least get you interested. Now, again, I've had an opportunity to be mentored and as well as mentor some folks. Um, I have watched the profession change a lot from compliance to a number of different things, from just standards to now being involved in risk management and legal and claims and depending on the side of your organization, but very involved in the growth and success of your organization. So, next slide, please. So, National Safety Council, we couldn't have this without the council, and I hope that everybody on the call, your organizations are involved with it. And I am always throwing out the opportunity is get involved. And again, my mentors, they would not let me sit on the sideline. I think what they did was utilized associations and societies like the National Safety Council to help me improve some of my leadership skills, my communication skills by jumping right in. They didn't let me sit on the sideline just to attend. They wanted me to get involved as an officer. And it really, over my career, it's really helped me grow and learn. And I was telling the folks on the call earlier that I just came back from a very large construction risk management conference. I might even have more passion now about learning than I did when I first started in the career. And I'll show you why. But here's the National Safety Council. If you're not working with them, please do. Great resources, not only help yourself professionally, but your organizations. Next, please. We're going old school with the next, please. So, really, why I like to lay this out when we take a look at 1784, we've got these industrial revolutions. And over the years, you can almost backtrack and find out where safety was. And I tell you, in 1784, really didn't exist. I mean, if you got hurt, your family would have to go to work. If not, you didn't get fed or you didn't have food or couldn't pay for your house. 1870, kind of still the same thing. There was not a lot of protections for our workers, and it was really tough conditions, hard work. And again, if you were injured or hurt, it really, you were kind of on your own. We get into 1969, and certainly in the United States, if we have folks from around the world on the call, one of the things that really started to come up in the late 60s was the development of a lot of U.S. government agencies, particularly one that I'm sure we all deal with on a regular basis is OSHA. And so really we started to see these compliance opportunities come out. And really what companies were focusing on was following the rules and regulations about compliance. And so now we move up into now. We take a look at things now. We have cyber issues. We have networks, automated cars. We have multiple languages, cultures, issues from around the world, drugs, fatigue, auto liability. And so maybe we had these same exposures in the past, but now it seems more um, um, magnified because we see it all the time in the news and technology so fast. Our profession is like in the fast food lane of information. Some of it is good, some you just have to check on. So, next slide, please. So this is me. This is Carl Heinlein, 1992. This is my job. I thought I was the greatest safety professional ever. And let me tell you, I wasn't. I had a pager, and it was funny. I was telling somebody about the pager the other day, and they go, "You're a drug dealer." I go, "No, back in the day, you had a pager. You didn't have cell phones." And then I had to go to this thing next to it, a payphone. I would challenge anybody on the phone right now or on the call, where is their local payphone at? I can tell you, I don't know where ours are anymore around my community. The last couple were taken out about 10 years ago. And then this last funny thing, almost feel like a caveman, is I had a clipboard and I had to take written notes. So, that was me. Thought I was everything, had a pager, had to use a cell phone. So that's 30 some years ago. Now, next slide, please. Um, I learned a lot of things, and I promise everybody I'm not going to read these. I just want to kind of hit a couple of these things about the historical perspective of safety. And sometimes it really didn't come to like fall protection or things of that nature. It came really out of the medical side, lung related issues, blood related issues. So we start to get into inspections, and I will focus on the first, seeing that I live in Pittsburgh, Pennsylvania. There was this study, and I'll show you a picture of it. It was called the Russell Sage Foundation. In Pittsburgh, back at the turn of last century, was very industrial, railroad, coal mine, steel, tough, hard labor. So next slide. Um, so again, we watched this kind of continue to move forward. We talked about 1969. There is a great deal of push for occupational EPA, National Highway Transportation Traffic Safety Administration, OSHA, and of course, with the advent of the OSHA Act, you also had NIOSH, and we also had in the late 70s the Mine Safety Administration. So we could go back and take a look at history, but remember, in the safety world, and I heard this mentioned again at the conference I was asked, that these things are written in blood. And the interesting individual that was talking about it was an astronaut that talked about the Challenger and Columbia disasters. And they had procedures and procedures and procedures, but what they did was overlooked a couple of them. They became so commonplace that they said it was okay. And they had some missions that went up that went well, even with the failed parts. So we won't get into that, but we'll talk about we're always learning from the past in safety and moving forward. That's why we need more and more professionals in here. I think organizations through insurance, cost of business, it's the right thing to do, not only for the organization's business, but also their reputation as well. Next slide, please. So I talked about this Russell Sage Foundation, and it's up in the left-hand corner, death calendar for industry in Allegheny County. It's not the greatest picture, but if you take a look at it, more than 80%, more than 80% of the calendar has a red mark. That's 1 year. That's just Allegheny County. That's just one piece of Pennsylvania, one piece of the United States, one piece of the world. So basically, almost every other day, somebody was dying in Pittsburgh. And that's just death. That is not amputation, crushed, life altering injury. Another thing we hear, we have the car, what that's done, Valdez. BCSP's been around for 50 years. It's not too long ago where we had a little disaster in the Gulf where, again, they just received a safety award literally that day. And what happened? So, and then we certainly have our space shuttle accidents as well. So the mine that's down below, uh, that is a classic case of a mine in West Virginia that was nothing but silica, and there was no protections. And literally, these workers were coming out with lungs that were almost like concrete and were passing away. And so now we've moved. We just started getting silica related information over the last couple of years. I mean, there was information, but regulations and things of that nature. It just took, sometimes the regulation process is extremely slow. So next slide, please. So here's some things we're getting closer to our time. Chernobyl, the one on the bottom left, that's the Triangle Shirt Factory. We've all heard about that. That was the advent of starting a lot of organizations, including the American Society of Safety Professionals. Um, we have the young lady on the bottom right. She was really the advent. She wrote Silent Spring, really on the environmental side. You take a look up at the top left-hand corner, out of the Bible, Deuteronomy talks about protecting of their neighbors when they're working, and then certainly the bridge, the Golden Gate Bridge. There were a lot of things that came out of that safety-wise, and the individual that developed the process did everything from, the workers that were hungover made them drink sauerkraut juice. They put netting underneath the bridge. So safety a lot of times wasn't a government regulation, as we see that didn't really come in the United States till the early 70s. It came from organizations and people that cared. And so again, I'll go back to another thing that'll be a theme in here in the world that we live in. We're in the people business, and the caring and the passion about the people go a long way. So, um, next slide. Historical perspective, talked about this. And when you take a look at it, why I put these in here was about, the historical perspective of fatalities. So Golden Gate Bridge, 10 to 17, there's some of these are injuries, fatalities, and some are medical related. As we know, a lot of times the medical related issues take time, chronic related issues. And these numbers, Chernobyl disaster, they really do not have any really good idea on really what it did to their communities. Could be tens of thousands. Valdez, nobody died, but it ruined the environment for years and years, and they still have repercussions from it to today. BP Horizon, again, 11 to 17, Bhopal disaster. And when I went back to school, I happened to have an individual that was one of my instructors that worked for Union Carbide. And again, going back to the theme of our conversation of growing the profession, he had such an innate ability to take a look at his organization and said, we did it wrong. And we are going to improve, and we're going to grow, and we're going to share. And so what you'll find in safety and health as well is in a lot of organizations, they very much they don't want to share things because it may be a competitive advantage, or it just be better for their business. Where in safety, what you'll find in this industry is people are willing to share. People want to share. Nobody wants to see anybody injured, hurt, disabled. So because it's not only impact on the families, it's also impact in your communities. And I think over the years, you've watched safety and health and the profession grow from compliance for an OSHA standard or an EPA standard to now getting those thought processes of how do we protect our workers driving home? How can we help them, understand health and wellness a little better when they're back with their families? So, again, then we talk about the Challenger explosion. The gentleman's name, Roger Buzalagi, he was an individual that said these O-rings are going to fail. It will be it will be a catastrophe for the flight and for the crew. It's in all the reports. They discussed it, and somewhere along the line, here comes into balance of the safety professional. As we grow the profession, I always try to implore on people to understand return on investment, to understand you're always going to have that struggle between production, profit, quality, and safety, where hopefully you're within organizations where they work in a good relationship together, because if one's out of line, something else goes out of line. Case in point, if I'm building something and I put it in wrong the first time and I have to bring people back in again, now they're exposed to those hazards one more time. So rework. So working closely with my quality team goes a long way. So one of the more recent ones back in 2020, storage of chemicals, and it killed 210 people and it ruined the whole harbor of Beirut. And again, the news is a very interesting cycle. That happened in 2020, 3 years ago. That place is still destroyed, and it will take them a decade to get things back up and running, plus all the families that have been ruined forever. So, all right, got to talk about the past before we move forward. Next, please. All right, so we looked at the past. Okay, I am going to answer that question live, Dave. Thanks for the question. Appreciate it. It was a great question, too. All right, so next slide. So we've got to take a look at lessons learned. So this is me, November 2023. We've rolled out of COVID. Hard hats have changed, glasses have changed, high vis have changed. Now, heck, got my cell phone right here, handy laptop. So the world has changed. The speed of business is different. So for me and for everybody out there, for the first part of my career, I was truly a mentee, learning. Even though I'm still learning, a lot of my mentors have kind of retired now. So now I've kind of switched into a little bit of both, but more of a mentor for some of the folks that are coming up within our organization, talking about college classes and certifications and, meetings they should attend. And it's kind of fun. because they can learn from all the mistakes that I had. Next poll, please. Okay. So what do you see as the biggest challenge to the future safety and health professional? What do you see as the biggest challenge to the future safety and health professional? And while we get into that, the slide that sits behind it is something that is really, I think, where we need to start to focus. As this profession has continually grown and developed. Before it was a job. Now I am a big believer this is a profession. At the meeting I was at last week, and I was at the National Safety Council a couple weeks back, watching the diversity, watching the age changes, just watching how the profession has grown is extremely, it's exciting, and I am certainly a big fan of the future of this profession. So we have 65% are people, compliance and technology. Great answers. And really, I appreciate the amount of folks that punched in people. We are in the people business. And think about the world during COVID and after COVID. Think about the technology. Think about working from home. Think about all the stress that we have. So, in the world that I live in construction, we always say that falls are the number one killer. They may be the number one killer on the job, but we also have suicide. We have drug addiction. We have driving to and from work. We have fatigue. We have violence in the workplace, COVID, we have a diverse workforce. And see, this is always interesting to me because I think the United States and even around the world, the building of our country has always typically been based off, immigration. And that's fine. I embrace it. It's smart. One of the things I talk to a lot of my students about is making certain they understand who their workforce is and maybe trying to learn some of the words if they're working in the Northeast and they need Portuguese or Houston and Vietnamese or Spanish, just to understand Chicago, Eastern European, understanding a couple things like that as the profession growing, that will help you in that people side. So, mental health, distracted driving, everybody wants to try to keep things going on. Mental health is a crisis. I mean, I've had the pleasure of traveling around the world. We are the most pill popping society in the world. I mean, we have more prescriptions per person than I think that half the rest of the world together. And it is you don't have to quote me on that stat, but it is a United States issue that we have this pill for everything type of thing. So embracing women in the workforce, drugs, drones. It's funny. Everybody wants to talk about drones. Oh no, you can go to the next slide. Uh, Drones. I'm seeing more and more of them that aren't in the air. Now we're using them for tunnels and other things as well, underground work, so we don't have to expose people. So, but this is fun. This is technology. It took airlines 64 years to hit 50 million users. Took Pokemon Go 19 days. Technology, okay? Mobile phones 12 years, internet 7 years. Uh, WeChat, I don't even know if that's around anymore, but 19 days for Pokemon Go to hit 50 million users. So again, we're dealing with a different. We still deal with people, but the around the environment and the things that are around us are a lot different. So next, please. All right. So today we're here to talk about our profession, my profession, your profession, folks you want to bring into the profession. We are truly heroes. And this is, I mean, during COVID, we heard about nurses and doctors. I truly think that our profession, and I've talked to a number of magazines about it, and I've talked to, Engineering News Record in the construction industry. I said, we missed an opportunity to talk about all the great things that our profession did to protect workers on the job, in their cars, at home, in their communities. So again, I love this profession. I have a great passion for it. We do wonderful things. But here's the other thing. We don't get a pat on the back every day or, hey, we know if we did something right. That's not what we signed up for. So I just want to thank you. I really appreciate your interest in this. If you're already a safety professional, you have some safety duties, you want to get into the profession. Um, I got the greatest job in the world. I promise you that. Next, please. All right. So recent news. This is some things that, is again, why we want to grow the profession. Motor vehicle deaths, highest in 13 years, despite the drop in drought miles driven. So during COVID, you notice the date on this, miles driven were lower, but fatalities were higher. Fatigue, distracted driving, speed. Three things: speed, distracted driving, fatigue. Fatigue is one that I struggle. I don't. I'm trying to figure out how to work with my contractors to try to talk people in not working more hours, because when they work more hours, they make more money. And to go against that, to say at a certain point, you're not productive. You're dangerous to yourself, and then going home even more so. So fatigue's a big issue. All right, so look at this next one. Survey finds fewer Americans satisfied with workplace safety. According to the poll, 65% of U.S. workers safety, they are completely satisfied with the physical safety conditions at their workplaces, compared to 74% the year before. So again, the satisfaction of workplace safety is going down. Violence on the job, uh, people taking shortcuts. We got to catch up with production. We're coming out of COVID. We got to make money. So again, another opportunity for our profession to help work with our organizations, our board, our leaders, our operation, our floor plant managers to make it go. So then I just put a COVID thing in there just to remind everybody there were 28 million cases on March 10th of 2020, and deaths. And it seems so far away ago. I was talking with somebody this week, and I remind them it wasn't too long ago that everything on the news, everything we touched, everything was COVID. What are the lessons learned that we need to carry forward? For me in the construction industry, it was staging contractors, it was hygiene on the job, it was rotation of jobs. So it's not a perfect situation, but we continue to learn. Next slide, please. Okay. So today, the present, we talked about the COVID-19. Well, the interesting thing about it, I was with folks 2 weeks ago that they have 3 people in their family that have COVID. So COVID is not gone away. It's just not in the news enough. So hopefully, you understand that. Total worker health is a huge issue. So again, I talked about really as we grew the safety profession up into the 70s, all these acts, all these organizations and departments stood up, OSHA. But total worker health is something that I hope your organizations are taking a look at, because we have a crisis of workers. We need more of them, certainly in construction. I'm sure in in the industries you're in as well, truck drivers, maritime, you name it, nurses. We need more people. So we can't afford to not only get people hurt on the job, but off the job. So what are we talking about on wellness programs, weight reduction, smoking cessation programs, gym memberships, just to get people to be a better person. And this is something that we're seeing now in studies as well, that organizations that offer this type of thing are also recruiting people better than other organizations that aren't. Money is a very big driver, as we all know. But when people start to take a look and at certain part of their careers and they see everything that comes together, it certainly helps in the recruitment. So mental health, I think people are tired. And, we talk about drugs and things of this nature. This thing in my hand right here, I'm getting back in the screen, cell phone. It's the most addictive thing we have. It's never further than 6 feet away from you. When it bing bongs, lights up, you got to take a look at it. It's insane. So I gave a presentation this week on auto liability and fleet safety. And on the ride over, I sat at a stop sign, just sitting there before I went in the convention center. This was down in Orlando. I sat there 15 minutes, and almost every person that stopped at that stop sign took a look at their cell phone. 15 minutes. So do you think they're concentrating on the person in front of them? They're driving, their minds go. What happens is their mind never shuts off. The speed of information right now is wearing us down. We've got to take time out, got to do some exercise. That's where that total worker health comes in. Addiction. 1 out of 12 people on your job have some sort of addiction to something. And when you think about that, people go, what? And these are coming out of the National Safety Council. They're coming out of the organizations that are taking a look at addiction rates. I've had the good fortune of working with the National Safety Council on some community outreach on addiction, and it's not just folks in the country or folks in the city. It's white collar, blue collar. It's every collar. Addiction is something that many times in our organizations, and here it comes back to the reason of our presentation again, the importance of growing the safety and health profession. Many organizations in the United States and around the world are small organizations. They don't have a risk manager or an HR director or a legal department or something. That may fall on the safety and health professional that has to deal with insurance and health, safety, claims. So a lot of things I want you to take a look at as we talk is also the team concept. You can't do this by yourself. So here's another really important thing is you've got to grow your networks. You can't do it all by yourself. I talk to a lot of students and they're super smart and I watch them struggle with their ability to communicate with other people. And I say, this is an area where you work. Go to a Carnegie Mellon class, go to a speech class, get involved in an organization, coach some little kids, get those skills because you always have to work with people. So thinking about addiction, is that a HR issue? Is it a safety issue? Well, what I tell people is depending on your organizations, it's a team issue. So take a look at that. Fatigue, it's costing every organization out there per employee $1,200 to $3,100 each. So that's people who are coming into work, they're tired, they're just staring at their computer screen, or they're sitting extra at lunch in the truck going, oh gosh, I'm tired. I still got the rest of a day going on. So something to take a look at. And I really struggle with this one because in construction, we push to get things done, but yet we know fatigue's an issue. So this is an area we're focusing on within our contractors is how do we have that balance? How do we make sure people aren't driving 2 hours to work, 2 hours from work, then working 10, 12, 14 hours? So big initiative for us right now. Again, I talked about driver safety in 2019, worst year of auto liability. For folks out there on the call, 100 and plus folks that are on the call, what is your biggest exposure for your workers every day? And I would say you're going to hear falls and excavations or electrocutions. It's probably driving to and from work. So certainly an area that safety professionals coming into the industry or are currently here, we need safety professionals to help with that exposure of drivers, not only on the job, but off the job. Workplace violence, I talked about. Number three, killer for workers. When you think about it, it's again, when you start to connect the dots with a lot of these things, you could see where they all come together. That's why total worker health is important. That's why communication with your employees is okay. You got to let you got to let them calm down and have an opportunity to talk. People just want to, feel like they're part of a team and people listen to them, so this is it. The other thing that I think safety and health professionals have an opportunity to really step in and help out is emergency preparedness. Think about the wildfires, think about the floods, think about the tornadoes. I happen to work for a couple companies that are very engaged in emergency preparedness, and it goes a long way. So again, we as professionals, as we keep continually to grow, we also have to have more tools in our toolkit. So if you understand how FEMA works, or you can help with the Red Cross, or you can, some of our folks out in Hawaii, when they had the tragic fires out in Lahaina, they jumped right in. They brought their equipment in there. They helped the fire department. They helped the people. And so, some of your organizations, you are in the community. You may be one way or another involved in the emergency preparedness. So sometimes I see that as gets parked in the back lot for a lot of folks. So as a professional, more tools that you have, more contacts you have, certainly helps your organization as well as yourself. Next slide, please. Okay, here we go. What are the resources that would assist future safety and health professional best? Do 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 do. Just had way too much coffee today. I'm sorry. Um, Good. Give you another 30 seconds on this. Um, and I think this is where we start to close out. I think this is important as we get to the end of the conversation. We've got some great questions that are teed up here too. Is every profession out there, doctors, lawyers, bus drivers, laborers, they're all trying to do the best job that they can. And so, is it through a trade union? Is it through an association? Is it through a mentor? Is it through a journeyman? There's lots of opportunities. Oh, let's see the results here. Mentors. And that I love seeing that as the number one out there. All of these, this was not a trick question. All of these are important in your growth. But I think, and I have 4 mentors I can name off. I still talk to them on a regular basis. They still coach me like I was, just started in the profession. And I appreciate that because without them, I probably would have gone sideways or I wouldn't have done some things. They pushed me. So hopefully you have mentors and hopefully you're also maybe you're mentoring other folks on your team as well. But societies and associations, National Safety Council, ASSP, you know board of certified safety professional is not a society or an association, but it is a trusted ally out there on growing the profession. Their mission is just as important as ASSPs, National Safety Councils, AIHA. There are resources out there. And then also, if you're in like for me in construction, uh, I work very closely with the AGC of America because it's a construction association, but they also deal with safety and health. So as we take a look into the future, we'd love to have the crystal ball, but some of the things I can tell you, next slide as we move forward, is education will be important. Understanding the change in our markets are going to be important. I was at sounds like all I do is go to conferences, and I kind of do. But earlier this year, the Construction Expo was in Las Vegas. Construction, I don't know, 140,000 people. I've seen more technology, and they only do it every 3 years. Robotics, autonomous vehicles, autonomous equipment, technology, tracking where you're working on the job. If I don't move for so many minutes, it's going to send a ping back to my office. Better check on the worker. So we all know this. Technology is coming. It's here. It's not coming. It's already here. How do we embrace that as a safety professional? And I encourage you to, again, start to reach outside of your box, of your thought processes. And there's so much information out there. That's where your mentors, your societies like the National Safety Council, and I'll give you a couple links here at the end, kind of bring you a little closer. You should be involved in a team that's bringing on technology. You should have a part of that because it might be great technology for operations, but what exposures does it create? So as we move into this next phase of our careers, our profession, the world with technology, robotics, AI, all this stuff. I mean, right now I could probably write a toolbox talk on my chat GP without even doing anything. Just say, hey, I need a toolbox talk on ladders. Okay. It's going to be perfect. Maybe, maybe not. But what does that do for folks that are in education and stuff that they just use that for their papers? Are they learning anything? So there's good with it and bad. That's I tell people with technology all the time. Good, bad. You just have to weigh it out. One of the technologies out there now is nanotechnology. That means so small. The fibers, the cells, the development of these things are so small. We don't know what it does when you cut it or burn it or melt it or freeze it. So technology sometimes is out in front of the safety and health process. I just want to kind of keep you in mind here. And I don't want to forget about this as well, because a lot of folks will have safety, health, as well as environment and security. So I don't want to forget those last two, that environmental side and security, because I think those, again, more tools in your toolkit, the more opportunities you're going to have, better resource for your organization. So the lady right there at the bottom with the pink screen behind it, that's a robot. I think the National Safety Council has one of those in their office up in Chicago. answers basically answers the phone calls, everything of that nature. You have to check in with her before you go into the office. So we're seeing that. And organizations are smart. When they see that they can't fill positions, they're going to figure out how they can do it. And so technology is fixing that up. You see our friends in the military over there, how do we reduce back strains and sprains? Well, is there a tool or some sort of exoskeleton that can help us out? Sure. So um, it's fun to watch. I live in Pittsburgh, so I see a lot of stuff out of Carnegie Mellon and the University of Pittsburgh, and a lot of incubator startups around here. A lot of stuff with Uber and autonomous driving. So good. Next slide, please. So here's where we're at. And when you take a look at this calendar, which is I've shared this from our friends at NIOSH and Dr. John Howard, is artificial intelligence. It's here. Um, Meeting with some vendors this week, and it's almost spooky on how quick it learns and how quick it learns and how quick it learns. So what it learned yesterday, that's piece of cake. Today they're already trying to figure out how it learns even more. So for me, it's interesting to watch. I have to reach out to folks that are way smarter than I am to kind of take a look at this, because you go from your artificial intelligent, your machine learning, and your deep learning. So within your organizations, if you're new to safety or you're looking into safety or your operations or whatever, maybe you're working for the Safety and Health Committee, you got to figure out how these things are an advantage for your teammates or how they may expose you. Because sometimes just because they're a machine doesn't mean they can't hurt you, because they don't have any feelings. They don't get sick. They don't shut down. They show up every day. They don't care if you like the Browns. They don't care if you like the Steelers. So when you get into this, and we're watching this, we're calling it, in our vehicle related issues, is these autonomous vehicles. We've got to figure out, just because it has technology doesn't mean that we can't get in the way. We need to respect that. So we can't just assume. So I just like throwing that in there, because really, when you watch this keep going, artificial intelligence has been around for a long time, but now it's on this like toll path. Every day something else is coming new. So um, then the deep learning, it intimidates the heck out of me. So when I landed in Orlando with my cell phone, this fun little thing here, what do you think popped up? An advertisement for a restaurant in Orlando. Kind of spooky. So I'll share one story on auto liability, and then I'm going to close it up here in a couple minutes. Is auto liability such a bad coverage right now because you've got a cell phone and it's tracked all the time, but you also have a computer in every one of your cars that tells you where you've been, what you're doing, how fast you're going, when you hit the brakes, and all that. So attorneys have found this pot of gold for organizations that don't follow their safety rules, because they have all the answers right there for you through their technology in the car and in your phone. So next slide, please. All right, that's me. Hello. Um, Next slide. We talked about this. Really, the thing I think for all of us as we move forward is that relationship between the human and machine, as well as we can't overlook the relationship between the humans. So really unbundling work from our jobs. We have a company around here that used to tie rebar for bridges and rebar cages and stuff. Now they got a computer that does it. Does that mean that people lost their job? No, they just shifted them into a different capacity. So we have to watch how we shift from the technology with our people and where we can put them. And in many cases, like I said before, we may not have the workforce. The other thing is too, we've got to be very cognizant, because everybody on the phone here, one thing that every environmental safety and health security professional does, it's safety and health. Is it health and safety, environmental health and safety? We all do some sort of coaching or training. So we have to adjust as well on what our training methodologies are, our training techniques. Are they micro learning? Are they more visual? Are they hands on? You're still going to use some of the traditional, but we've got to adjust as well. All right, next slide, please. Again, this is a slide that I just want to show out there that we showed this to our contractors the other day. Again, this was a slide that I pulled from John Howard's presentation about the future. And as you could take a look at this whole complex thing, what I kept saying is, where do we put safety and health in here? Where does it fit? It should fit everywhere. That should be the dotted line between each one of those. So you've got 3, 3, 3, 3, 3, up, down, sideways, corner to corner. There has to be some sort of environmental safety health touch point in these. So it's great that technology's going, but as we grow the profession, they're going to need people like you that are on the phone here that can help make sure that this works in a proper method, but doesn't expose us to environmental issues, safety issues, reputational issues. Next, please. Okay, so here's what we're going to close out on, and then I'll give you some resources. So we have to continue in the safety and health professional. And why we need folks in the profession is we've got to lead by influence. We've got to be smart. We've got to be researched. We have to understand. Always leading by example. This is something that every leader should be, but in the environmental safety and health field as well. The rules are the rules. I always tell this people in the military, when you went to boot camp, they didn't say, go ahead and do 7 push-ups today. They kind of laugh about that. Why do we let the rules kind of a little fuzzy in the safety world? I always tell people, if somebody stole from a job, they'd probably get fired. Somebody showed late up for the job all the time, they get fired. Somebody breaks the safety rules, what happens? They become a manager. See, that was funny. Send a consistent message. Work on it, make sure it's consistent, because workers are just looking for that first opportunity where you said, well, okay, it's okay to do it this way today. Tomorrow you can do it that way. No, you just have to lead again by example. You have to lead by influence. You have to be consistent. Understand that balance, as I talked about, between production, quality, and safety. It's okay. It happens every day. You can work collaboratively, not against each other. Have an intimate knowledge of the process and risk to the operators. If I tell any folks that come into this, doesn't matter their age, their background, get out and watch what the troops do out in the field. What do they do? Ask them questions. Look at it, observe, learn. People take pride in what they do. Translate complex rules and regulations. They're looking at you as a profession to take a 600-page document about the heat standard and break it down into something an executive can make actions on. So again, that's where your research comes in. If you don't know, you don't know. Next thing, identify gaps between continuous improvement. And then always keep involved in organizations like this to keep up to date on what's happening with the environment. Okay, 2 more slides and then we'll open it up. Next, please. So I want you to just have these. You have the BCSP. They have a link there, plenty of resources. Plus, they also have money for scholarships if you want to do some stuff. The National Safety Council Work to Zero has some really good things on the future of work and tools and how you work collaboratively, safety-wise, along on them. So those are 2 in there as well, I think are BCSP and the National Safety Council, and some of their resources are excellent for anybody on the call here, regardless of your experience. All right, last slide. Okay, influence, next one. It's us. Next steps. So my challenge to everybody here is the future is bright for this profession. I mean, I hear salaries and opportunities and things I've never heard in the past. I started with a master's degree. I'm laughing because some of these young folks and new folks in the profession are coming out. They're making triple what I made with an undergrad degree, and they're begging for more people. So the future is bright. There's a lot of things to do out there. So next steps for you. Please think about a personal development plan on your own. Think about the education tools that you could go out there, certifications, training programs from National Safety Council. Okay, so we have 6 minutes for questions, and let's do it.
All right.
Okay.
Yes, excellent. Great job, Carl. Thanks for sharing your insights and your expertise. And thanks also for that shout out to Alice, the virtual receptionist at the NSC building. We'll be sure to give her your best.
Yes.
As you said, we got a few minutes for Q&A. Before we do that, though, just want to let everybody know about the evaluation survey that we're asking you to complete. That survey will open in a different screen after the webinar. And as always, we appreciate your input as it helps us improve our future webcasts.
Please do.
All righty. First question. This asks, what do you think of the statement, and this is coming from a CEO, that, quote, "We are not in the business of safety. We only put enough safety in place so as not to hinder our productivity"?
That's a culture issue there. I mean, for me, I don't know if I'd want to work for that organization. Personal Carl, this is Carl Heinlein's not National Safety Council. So again, I always take a look at it. Do I want my kids to work for this organization? Safety is the most important thing that every company has is the people. And if it's led by a CEO that doesn't understand that, they may make all kinds of money and things of that nature. Somewhere that's going to catch up. You pay now or you pay later. You want to have a CEO that leads, and I have CEOs that I've never heard them say the word employee. It's all teammates. They talk with their folks. They're engaged with folks. So, there's a lot of folks out there that are bosses, and there's a lot of folks out there leader. They may be a very nice individual. It's just that comment to me makes me stand back, going, that's production's way out in front of it. I understand how important production is. I understand how important quality is. You can't do things without those. But if you're not protecting the most important asset that you have within your organization, eventually the shoe's going to drop. You can only be lucky so long. But really appreciate the comment. And I think that a CEO like that asked the question is probably a leader and not a boss, because you're participating in something like that and you're driving your employees to that next level and challenging them. So I think that was a good question. I'm sure that's not how you run your organization.
Next question. What advice would you have? It says a lot of organizations might just strive for compliance with OSHA, which you touched upon. So what would you say about taking organizations to the next level and really raising the standard above just minimum compliance?
Great question. I would always, and again, partnerships, collaboration, teams. So your CEOs of your organization are probably always involved in some sort of networking or peer groups or something like that. But the first place I'd start is talk to your insurance company, start with your broker, and bring them in and say, hey, we're here. We want to take the next step, because the better you do, the better they do. You're not losing any finances for them, and makes it easier for your renewals on insurance. So that would be my suggestion is, you already are paying for your insurance company and your brokers. Bring them in and sit down and have just a, analysis session, gap analysis. Let's take a look. We'd like to be here. There's nothing wrong with compliance, but you just have to remember it takes forever to write these rules. And so, it's a slow process. It's minimum standards. So there's always opportunity to do best. I'm not saying it's a bad thing, but they're minimum standards. Work with your insurance company or broker to start out with. And if you're involved with any industry associations, reach out to their safety and health or risk management committee or their professional staff at the national level as well. Good question.
All righty. Next one is asking about safety mentorship. Are there any, just starting points or recommendations you'd have for programs or places to start with safety mentorship?
I do, and I'm going to talk about one of your other groups in the local area there. The American Society of Safety Professionals has some mentoring programs. Some of the associations like the AGC of America, the Associated General Contractors of America, they have a mentoring program. But I would really take you, what you try to do is, and I've dealt with a couple of them, is what you want to try to do is, depending on the sophistication of your company and how large they are, you may have an existing program internally. If not, it doesn't always have to be, this really official setup. Maybe there's some people within your office that you could just ask that maybe have a little bit more experience and say, hey, can we just meet like once a week for a cup of coffee and, kind of give me a little guidance of where you've been and all that. So sometimes it's not always an official program, and then also take a look at the National Safety Council. There may be some folks that that are involved with the council that would be glad to help you out.
All right. Well, you've been quite thorough and we appreciate it. What, if anything, has been left unsaid?
Well, I think I want to go back to one question that just popped up right now. So I want everybody to think about this. So I get a lot of questions about this, not only domestically, around the world. Professional certifications. So a certificate is something, if I taught this class right now and we had a quiz and I gave you a piece of paper, that's a certificate. Never have to follow up on it again. Don't have to do it. Certification is something where you study for it. You have to renew with continuing education, every 70 years, 5 years. But if I pulled up on the website right now, how many environmental, safety, health, security certifications are out there? Well over 400. I'll tell you, and I know a lot of people I'm all for continuing education, but you have to think about what you want to get out of it. I tell people to look on job applications and what your company looks for, because there's a lot of folks that spend a lot of money on certifications that aren't worth the paper they're written on. You might get some education, but if you think it's going to drive your career or get you a job, that's not the case. So buyer beware, do your research, make sure that that's going to enhance your career, not just take your money. Now, again, I'm all for education. There may be some pieces in there that are good, but I watch a lot of people come back and they go this, and this, and I go, I've never seen it, never understood it, don't never seen it in a job application. So just be buyer beware with any of your education, but keep learning, always grow. One last question, if you don't mind, before we go out, I know we're a minute over, is there was a question about Narcan. I think that today there was actually a national, in the construction industry, there was a call about it. I think the opinion is kind of maybe sort of, is it good? Is it bad? Narcan is one of those things that I think you're going to continue to see more and more information on. And to make it even better, the individual that asked this question, I would encourage you to call the National Safety Council. They're one of the leaders across the board around the world on this. And I know that they have folks that are way more educated on this. I'm sure they can help you with programs, the pros and cons. They did a very large focus on it down at the Congress and Expo last month in New Orleans. So I don't think I've got the best answer for you, but I know the National Safety Council will. So, well, oh, it's funny. I actually have one of my students in here. So thank you very much. Great to have you. Hey, and I have to leave at this. I thank each and every one of you for what you do. I mean, communities, organizations are better for what you do. Have passion. There's some days that are going to be better than others, but I'm honored to share some of the things I had with you today. And I'm very easy to track down. If you have any questions, follow up with me, please. Thank you very much.
All righty. Well, no, certainly. Thank you, Carl. We really appreciate your honesty and your candor with so many of these topics. Fortunately, we have run out of time today, but once again, just ask you to please fill out that evaluation survey that's forthcoming and give us your feedback. With that, we end today's Safety and Health Magazine webcast. We'd like to thank Carl Heinlein, everyone at BCSP, and all of you who listened in. Thanks and have a great day.